An uncontrollable itch dictates your life. It shatters your sleep cycle, breaks your focus during the day, and leaves you physically exhausted. We are going to build an evidence-based, step-by-step routine to begin neutralizing these itch signals and restoring the skin's physical barrier. To execute this protocol, you will need 3 things right now: a cool compress, a thick, fragrance-free moisturizer, and a gentle, non-soap cleanser. Solving a severe itch requires an engineering approach, a systematic process to identify and neutralize inflammatory triggers. Step 1 is stopping the physical damage. Put down your hands and apply that cold compress directly to the itchy area. The cold temperature physically numbs the hyperactive nerve endings firing off in your skin. This diagram illustrates the itch-scratch cycle. Scratching drags a fingernail across the skin surface, opening microscopic fissures. These cuts allow pathogens to enter, triggering the immune system to send more itch signals. Environmental accelerants like high heat, wool, and fragrances multiply these inflammatory markers, spinning the cycle faster. The same rule applies internally. Spicy foods and alcohol cause your blood vessels to dilate, which ramps up the internal inflammatory response and makes the itching worse. Now that the immediate triggers are removed, we move to the washing phase. You need to take a shower using lukewarm water, and you must limit it to a strict 20-minute maximum to prevent heat-induced flare-ups. During this wash, throw out harsh alkaline bar soaps. They strip away your skin's natural lipids. Instead, use a mild, non-soap Syndet cleanser to preserve the barrier. You can test if you washed correctly by how your skin feels afterward. It should feel pliable and hydrated. If it feels tight or squeaky clean, you have stripped too much oil away. By removing environmental triggers and washing with care, we halt the acute inflammatory damage. The skin is now properly prepared for structural repair. Once you step out of the shower, a critical 3-minute window begins. Take a towel and gently pat your skin dry. Do not rub aggressively. If left alone, the water you just absorbed will rapidly evaporate. In this microscopic video, water droplets escaping from dry skin cells cause them to shrink and peel back, leaving the barrier compromised. To lock that moisture in, immediately apply a generous layer of your thick, fragrance-free, lipid-replenishing emollient. When choosing that moisturizer, check the back of the bottle. This label shows exactly what to look for: clinical ingredients like 2 to 10% urea or 20% glycerol. These specific ingredients act as humectants. They function like microscopic sponges, physically drawing moisture back into the cellular structure and holding it there. For the most severe, localized spots that are still driving you crazy, we apply targeted over-the-counter anti-itch topicals. Look for creams containing active cooling agents. Menthol, camphor, or polydocanol will chemically override the nerve signals and provide rapid relief. Alternatively, you can use a local anesthetic ingredient like 1% pramoxine, which directly numbs the skin on contact. If you are using over-the-counter hydrocortisone, you must follow a strict limit. Cap your usage at 1 to 3 weeks. Prolonged application causes irreversible skin thinning. By combining systemic barrier repair with these localized chemical anesthetics, you build a comprehensive 2-tiered defense against the biological urge to scratch. When topical treatments are not enough, we have to suppress the allergic response internally using oral antihistamines. This matrix breaks down the 2 main classes of antihistamines. For daytime management, you must select second-generation non-sedating options. Mistakenly taking the older first-generation antihistamines during working hours will cause severe disruptive drowsiness and impair your focus. We also have to look at the neurological architecture of itch. The amount of stress your brain is processing heavily dictates the physical intensity of the itch sensation. To consciously lower your central nervous system's sensitivity to those signals, implement progressive muscle relaxation or mindful breathing exercises daily. Suppressing these signals on both a chemical and neurological level provides a dual-layered pathway to reducing chronic irritation. By executing this protocol, your skin should now feel dramatically cooler, calmer, and structurally sound. However, this flowchart shows the absolute clinical threshold for medical intervention. If your itch lasts for more than 6 weeks or occurs with no visible rash, you have chronic pruritus, and you must escalate to a dermatologist. An invisible, long-standing itch carries high stakes. It serves as an early indicator for systemic organ failure, including liver, kidney, or thyroid disease. These underlying internal or neuropathic problems require advanced prescription interventions, like gabapentin or phototherapy, that no home routine can solve. Daily barrier protection manages everyday flare-ups, but recognizing a 6-week failure is the ultimate safeguard for your long-term health. Subscribe to the channel for more clinical protocols and step-by-step health routines.